Hi, my name's Jane Jobarteh and I'm a tutor on the Masters in Public Health. And I really wanted to just talk a little bit about the impact of COVID-19 and what this pandemic has done to us. And I honestly can't count the number of times that people have said to me over the last few weeks and months that we are living in extraordinary times and this is a new normal. And actually, it's absolutely true. And, I think we really do have to acknowledge that this extraordinary new normal is something we've adapted to very quickly. And it has had a huge impact on how we work in the university, and how those of us in public health who have a day job outside of our study and tutoring, how it's impacted there too. One of the things I have done as a tutor is try to incorporate elements and discussions around COVID-19 into the Q&A sessions that we run, the sort of online tutorials, and give people an opportunity to talk. I think it's really important that we explore the impact this has had on us professionally, but also personally, because it is huge, and we do need to give that people an opportunity to share and to understand, and actually for ourselves to begin to process how this has in fact impacted on us. So my day job, as well as being a tutor, I also work for Public Health England, and my usual portfolio of work has been almost entirely on hold for 3 months. So I would usually work on public health approaches to serious violence and substance misuse. But actually over the last 3 months, I've done lots of things, but not related to that. So I've done some of the work that would ordinarily be done in the health protection team. I've made those calls in the early days of contact tracing to people whose friends or families have been tested positive for the virus. And I've been calling people, tell them they needed to self-isolate. I also took a lot of calls from care homes, GPs, people concerned about social distancing not being observed in their workplace. And some of those stories, of course, have a very personal and direct impact when people are telling you about people who are seriously ill or notifying you of a death, for example. I think we have to acknowledge the toll that can take on us as well. And I think our public health skills really do play well into this, our partnership working, our collaboration, and our reliance on the evidence. And I think sticking to those sort of principles of how we operate has really helped us get through this. And also how we've applied those skills in different areas. So, for example, as I said, I've been doing some health protection work, and I'm not a clinician by background. But most days I'm working in the Incident Control Centre, which is very much about managing the vast information flows that come from national teams to our more regional team, and things that we're sending back from regional to national, and also a way of responding to the huge amounts of queries and questions that are coming up almost daily, where people are finding that the guidance simply doesn't cover what they need to know. So in all of this, we've found ourselves working in new teams almost daily as we revolve in and out of these working cells in the COVID-19 response. And we've done some very agile working. It's very flexible. And I think for a lot of us, that challenge has been one we've been very happy to rise to. And actually doing that as well when we're sitting at home, be that in a home office, in a kitchen space, at the dining room table, that also has an impact. And I think how we maintain contact and keep in touch is also a great place for us to explore our public health skills. And I think particularly those around partnership and how we build those relationships and maintain them through these very difficult times. And I think we also have to acknowledge that for some people, the home working is really difficult. And we have those systems in place to try and support them and combat loneliness, which we know is one of the biggest negative impacts on our health and well-being. So we have WhatsApp, which I know people around the world have been using to keep in touch with groups of friends and colleagues. We also have, we use Skype in Public Health England, so we keep open instant message chats all day. We use Teams. We use all of those things to ensure that we stay connected as well as we can and support each other. So I think I just wanted to really finish by saying, I'm really personally quite proud of how public health has responded to this, and all my colleagues, and how everybody has been willing to let go of their day job, embrace this extraordinary new normal in terms of doing whatever they can to respond to this pandemic, and really to just keep going, even through the 7-day weeks that we've been doing, the long shifts, everything else. It's been an amazing thing to be part of, I think, in that respect. And I think it really does show us how valuable our public health skills are, and how if we stick to those core principles around reliance on evidence, collaborating, partnership working, we will not only do our best to support people through this pandemic response, but also we will learn a lot from it, and we can use that as we go forward in our public health roles and in our studies.